Hi guys, I'm here to tell you a little bit more about Benefis Health Systems, where I'm doing my practicum. So Benefis Hospital is a nonprofit health system that's utilized by the general public for any health concerns. Benefis was established after the merge of two Christian-based hospitals in Great Falls, Old Columbus and the Deaconess Hospital. The founders came from both institutions and believed in providing good care to all those in need and trusted that the merge between the two hospitals would accomplish just that. So the Benefis mission statement is that we provide excellent care for all, healing body, mind, and spirit. And Benefis works continuously towards being the best health system in Montana. The goals of the institution were founded by the Christian founders from both previous institutions, which to this day still remain. They are to provide quality and safe treatment, to remain cost-effective and efficient, to show respect and compassion, to all patients, provide noteworthy service and stewardship, and then to promote leadership and teamwork amongst their employees and to uphold the institution and patient integrity. So as a whole, Benefis is a comprehensive acute care hospital. So the services and specialties of the hospital range vastly and include like bariatrics, heart and vein, orthopedics, radiology, women and children, surgical needs, oncology, senior services, rehab, mental health, behavioral health, trauma care, pretty much everything in between. So there's not really like a strict guideline in order to be a patient at Benefis, I guess. So we operate under a board of directors. But under the board of directors is a team of Benefis professionals, and they operate as an executive leadership team. And they kind of bridge the gap between the board of directors and the system leadership team, which is right below the executive leadership team. And the system leadership team bridges the gap between like executive leadership team and then like all the directors at the hospital. Each unit also has a chain of command in which the unit or the floor has a manager that kind of sits at the top of that chain and directly reports to the system leadership team. So for the social workers, where our title is transition planners, and we sit on the care coordination department. The care coordination department has kind of like three different branches, I guess, for our chain of command. We have the utilization review, CDI, and then transition planners or social workers. So each section has a manager. So as transition planners, we report to the transition planner manager, and then those three managers report to the care coordination director, who will then report to the system leadership team, if that makes sense. It's a little different, but so Benefis serves about 230,000 residents yearly across a 15-county region, and patients are eligible for treatment by just being admitted by a doctor's diagnosis. So like I said, there's very little specifications in order to be admitted as a patient at Benefis. However, we do have some situations where there is an exact clear diagnosis in which we can't admit as an inpatient, and so then we do admit them under observation is what we say. So they still can kind of come in and we get to treat them as a patient. We don't have to charge them, and we kind of, I don't know, it's kind of like the institution part of the hospital, and so we call that observations. But for care coordination and transition planning, we meet with patients initially upon admission and assess their livelihood pre-hospitalization. So based upon the assessment, we document within the patient flow chart so that all of the professionals that work with the patient can have access to that as a general assessment. And then based upon that assessment and then the continuing care done by the patient's treatment team, which consists of like the attending physician, the nurses, physical therapists, occupational therapists, respiratory therapists, and pretty much anybody that treats the patient at any time is part of that treatment team. They decide, the treatment team, based upon their continuing care and that initial assessment that the social workers do, will discuss ideas for post-hospitalization and kind of the goals that they want to work towards. mainly the main goal is to get them back to the baseline that they were at before hospitalization, if not better. So if the treatment team deems fitting, then the transition planner will follow up with the patient and get back re-involved, I guess, and we work with the patients to develop a safe plan for discharge and transitioning to whatever facility, whether it's home or a different facility after hospitalization. So the discharge plan really can include all kinds of things, identifying the needs of that patient to ensure their safety and health and kind of reduce the risk of them ending up back in the hospital because their discharge plan failed, I guess. So it can include things like the follow-up care, like continued dialysis, infusion center appointments, so like having IV antibiotics and things like that, behavioral health consults. We make sure that they have all the safety equipment they need for their home, such as like single point canes, walkers, wheelchairs, bath and transfer chairs, sock aids, things like that, so that they're safe in their own home. We also handle all referrals to outside agencies like rehabilitation facilities, transitional care units, assisted livings and nursing homes, hospice, swing bed units, things like that. We also participate in care conferences with the patient and their families and kind of assist, aid, and support them as they're making really important decisions in terms of the patient's care. We do a lot of insurance investigating, we call it, so we kind of get in touch with insurance companies and advocate for high percentage payments for those patients and things like that. So basically we do a little bit of everything as social workers in the hospital. Each patient kind of has their own specific needs and we address those as the time comes, and we get to see a little bit of everything, so it's an awesome experience. So yeah, that's Benefis and what I do there. Thanks, guys.